I'm Anthony Nguyen. Join us as we change the narrative around aged care, one story at a time. Nice. Welcome back to the Pioneers in Aged Care podcast. Here we have Tom Symondson, the CEO of Aging Australia. Thank you so much, Tom, for being on the podcast.
Thank you for having me.
Look, very excited to have you on. Before we get started, I wanted to say thank you to the sponsor. The sponsor is Aurelia Legal, which is an immigration law firm focusing on the aged care sector, specializing in navigating 482 and 186 visa sponsorships. So thank you so much for your support. Otherwise, we wouldn't be able to have this conversation. And Nilesh Bansal, the founder and principal of Aurelia Legal, does have a question for us, which I'll ask during the conversation. But firstly, why don't we get started for people tuning in for the first time, never seen this podcast, don't know anything about aged care, but they're interested in getting into the sector. What is Aging Australia? What do you do for the sector? Where is your place in the sector?
Well, we are the peak body or the industry association, whichever language you prefer, for all providers of residential care, home-based care. We have a huge number of retirement village operators, seniors housing operators, affordable rental for older people, as well as community services targeted at older people. We've got over 1,000 members, and our members would be about 80% of the total service delivery in Australia for people over the age of 65. So we've had a long history. There have been lots of peak bodies over time. People will have heard of Leading Age Services Australia, LASER, or Asian Community Services Australia, AXA, and people with longer memories will go back and be able to remember dozens of others. But over many, many years, we have managed to get to just one, and that is Aging Australia, and I'm really delighted that we've been able to do that.
And what does a world in which there is no peak body look like? What type of chaos would we be thrown into?
Well, people might say it would be better, but my personal view is that peak bodies, I came from the UK, and something like peak bodies exists in the UK, but there's only one government in the UK. There's the Westminster government, and then there's a load of councils. There are no states. So there's a very small number of associations. They tend to call them trade associations rather than industry or peak bodies. And they're often a little bit lost in the noise. So in the UK, there's lots of think tanks. There's like 50 think tanks for every topic, whether it's affordable housing or mental health for older people, or you name it. There's plenty of voices. In Australia, there are those independent voices, but there are far fewer of them. And there's also the states, the territories, and the Commonwealth. So there's governments all over the place. Without a peak body, that means a sector, particularly a national sector like ours, just cannot get the traction necessary to either advocate to governments or work with governments or even represent themselves in places like the Fair Work Commission. If you need to do things like the work value case that we saw happen that increased aged care workers' salaries, you can't do that without a peak body because every single provider would have to do it independently. There's just too many moving parts. The other thing is that there's loads of peak bodies in this country. Most of them are very, very small, 2 or 3 staff, and they will struggle to get that traction. We're much bigger. We'd probably be one of the 5 biggest industry associations in Australia, and we've only been able to do that by bringing all of the other associations together and getting the whole sector behind us rather than splitting the membership artificially. And so we have resource. So we can do that job even more because we have the staff and the expertise and the skills and the coverage necessary to do it. So I think peak bodies are so important, but it's really helpful if you've got one that's big enough to get access, which we are and we do.
Yeah. Tell me about your journey into aged care. Was Aging Australia your first foray into the industry?
My first formal foray. So when I lived and worked in the UK, I worked in local government. So remember I said there's only one government. But then there's, in England alone, because remember the UK is made up of 4 nations, but I worked in England and focused on London, there's about 350 councils. And they, because we don't have a state level, they will run or regulate and fund aged care, services for children, services for people with disabilities. They will run primary education, and they'll have a huge role in place shaping and funding improvements in communities. So it was a really big beast. And because it regulated aged care, didn't run it, but regulated it and funded it, I got involved very early in my career in things like how do you commission aged care services, called social care in the UK, but aged care services in growing population areas where the population is outstripping the current services. Or what policy settings should we put in place as a council to ensure that people get the money from our services who need it most, and we're not providing money or subsidising services for people who probably could pay for them themselves, because the money is much tighter in the UK. It's one of the things I noticed when I came to this country. Our public services are often actually a lot better funded and a lot more universally available in Australia, apart from health, because of course they have the NHS, than they are in the UK. So that was my first foray, and then when I moved to Australia, my first kind of permanent job was working for the Victorian Healthcare Association. That was my first association job, which represents public hospitals and community health services in Victoria. And after a couple of years as the head of policy, I became the CEO of that. And Victorian health services run a lot of aged care. A lot of beds, 12% of all of the residential beds in Victoria are run by the public system, which is blows the rest of the country out of the water. And community health runs a lot of what we now call CHSP, but back in those days was called HAC, or Home and Community Care. So I was kind of in and around it, but my focus was on things like preventative health, emergency department admissions, and all sorts of much more health type things.
Yeah.
So this is my first job where aged care is my total focus.
And how long have you been in this role now?
I hit 3 years on the 26th of September, so I'm coming up for my 3rd anniversary in the job.
And you would arguably have one of the most difficult roles in the industry, because I think people need your help and you're constantly probably getting a lot of complaints, and there's a lot of fires to put out. What keeps you going?
We don't get many complaints. What we get is what I would call feedback. So often, because we're representing a sector where the average person leading an aged care organisation has a very, very significant background in this sector or related sectors. I'm the new boy, even after 3 years. And yes, I am a very experienced advocate, a very experienced, in my humble opinion, I should say. Other people might judge this differently, but my experience is in policy development. It's in providing services, kind of B2B, from an association to a member, whether that's events or advice or industrial relations, whatever it might be. That's my experience. I am not an aged care professional. Just like in my previous job, I was not a health professional. I have no clinical background at all. So that means inevitably people are going to give lots of feedback, and we need that feedback.
Yeah.
But you're right, there can be a lot of voices delivering a lot of messages, and it can get really overwhelming for me and for my team. And so we spend a lot of time trying to focus those voices in until we can get to the point where we can say, okay, this is the position of the sector.
Yeah.
That's really hard, because not everybody's going to agree on everything you decide is in that bucket. But that's where we spend our time. How do I cope with that? Probably better now than I did a couple of years ago. Certainly spending a lot more time talking to members and stakeholders. It's not just about hearing member voices, because we also have to understand the voices of older people. We have to understand the government's position. You can't push back on a reform if you don't know why the government put it there in the first place, because they will just push straight back at you. Yeah. So you have to understand their motivation so you can try and find common ground. Much easier to get change if you get common ground. So yeah, I take a little bit more leave now than I did at the beginning. I didn't really take holidays for the first 2.5 years, and that's no good. Don't do that anybody watching. We all tell our staff to take leave and then we don't do it.
Yeah.
But, I did just recently have a very long holiday, which was very, very helpful, re-energizing. And I also made sure I've got a really good team around me, because you share this load with your team and they share theirs with you. And if you don't have a team you can trust, you can't do that. And I have a fabulous team.
I want to talk about your team, but firstly, all those voices coming at you with feedback. What are the hot topics right now?
Well, there's the big one, which is 1 November, and a whole heap of moving parts in that. Everything from ICT readiness, sector ICT readiness, then government ICT readiness, then what do the rules mean for the rules under the new Act? What do they mean? How do we implement them? Can we implement them yet with the information that we have? So there's all of those kind of what I think of as transactional pieces, because they're all things that we can work on, but they're not going to be things we're thinking about in 5 years. And then there's the stuff that hits much harder, and I think this is true for our members as well, which is the absolute crisis of older people not being able to get into services. So right at the moment, many of certainly the capital cities around the country, but also a lot of rural and regional areas, there are no residential beds, in essence. Yeah. And there's only one free when someone sadly passes away or moves to a different home. There are hundreds of thousands, in fact, we think now over 200,000 people on the home care package waiting list and waiting for assessment to get onto that list. Now, we're providers, and Ageing Australia represents providers, but we care deeply about older people and their experience. And so I've been really heartened by the fact that with everything else going on, all of the pain, the financial difficulty, the complex regulation that we have to comply with, the workforce shortages, all of those other things that we are dealing with, members have been incredibly clear that they want us, as their association, to push on that angle of fairness, to ensure that we are advocating to get better outcomes for older people. We don't represent older people. There are other organisations that have that mandate, but we deliver services to them every day, and our members are the ones that know them. The government doesn't know them. And so it's absolutely right that we would focus on that, and I'm just delighted that members have not just supported us in doing so, they have demanded that we do so. So that's the other big now issue. There's other stuff that we're looking at that's more mid and long term. I'm happy to talk about designing the future system.
Yes.
But those are the now things.
Yeah. And when you say designing the future system, how would you describe how it is now, and what does it ideally look like? If you could wave a magic wand, what would it look like?
Well, I mean, we're recording this here in Perth, where I've just been on a panel at an event for aged care, about aged care and the aged care sector, and this was the kind of question we were talking about in that event. The ideas, of course, are all over the place. Everybody's got their own view of what it would look like, but what I think we all boiled it down to is what we want is a system that enables older people to live the life of their choosing in the way and manner of their choosing for as long as humanly possible, as long as it is safe for them to do so. Whether that means staying in their own home with home care support, or for some people it does actually moving into residential care, because that's a community, and they may have lost that sense of community. But also that we don't have these artificial divides between systems. So you're a patient in a hospital, you're a resident in residential care, you're a client in home care. If you're a person under 65 with a disability, you're a participant in the NDIS. There should just be one care system. We talk about the care economy. There should be just one, and the older person shouldn't have to give a toss, frankly, about which bit of the system's responsible for them. It should just happen, and that is not the way it works today.
That just sunk into me. I didn't realise, we refer to each older person in so many different ways.
It's language matters, and we're not good at this, because ultimately that older person doesn't think of themselves as a patient, a resident, a client. They think of themselves as Tom,
yes,
or a citizen, or a human. We label them because that is convenient to us, for our systems and our legislation and our regulation. So if we were going to have a system in the future that we could all be really, really proud of, that wouldn't exist. People would be able to get what they needed, when they need it, where they need it.
Has there been any, was there any discussion or proposals put forth on how to unify the term?
Yes, I think the problem is that we're fighting against really entrenched behaviour and views and opinions and funding models and constitutions of the states and the federal government, all this kind of stuff, and public opinion, which is not actually, people don't necessarily agree on this stuff. They just know they want things to be better. But I think what we sort of come to, and certainly for us at Ageing Australia, we want to start pushing in that direction. We want to start drawing the roadmap to get from where we are now to that future where, not to put it really simply, but life's easier for older people. Ageing in this country is a more positive experience. Ageism is reduced and then removed from our public consciousness and our culture. And we have to make small steps because progress starts with progress. It's as simple as that. If you never start, you never get to that end point. And so for us, what we want to start talking about is grasping back the design of the system. The Royal Commission for the last however many years since it started has been our guiding force, and its reports have been our roadmap for future change. Well, with the Aged Care Act on the 1st of November, the vast majority of the Royal Commission recommendations are done. So let's start again, instead of just responding to the Royal Commission, let's say we now want to design the future. Because the Royal Commission wasn't perfect. The commissioners, I'm sure, would admit that to themselves. They did not know all of the answers, and some of the things they recommended in practice don't work. So let's get beyond the Royal Commission and design the future. We call it internally the continuum of ageing. That's where we want to. We want to talk about the continuum of ageing, including your housing, so retirement living, which is a big part of our membership, your needs being served within your home through home care, and when you need it, that availability of residential care, but thinking of it all as one rather than siloing it.
That's a lot to take in.
Sorry.
But I want to talk about your awesome team now. Tell me about your team and tell me what are the benefits of joining Ageing Australia as an employee or as an employer?
Well, so I said earlier about the fact that it's really helpful to have a big association. We are now and have been since I started, just the merging of AXA and Laser, the creation of the new organisation, made us one of the biggest in the country. But at that time we only had 110 staff, I say only. We're now approaching 150, which means we've got a real kind of capacity to start to do the things most associations can never dream of doing. My previous association, the Victorian Healthcare Association, had 20 people. You can't do career management. Well, you can try, but there's no career structure. Basically, everybody's waiting for me to leave so they can never go at my job. It's not quite like that. But these organisations, they're small. Your only way to progress your career is generally to leave them, which means you end up struggling to keep people because they can't see opportunity. We're now at the scale where you can see that opportunity. We can invest in training and development. Most associations don't have a staff training budget. And when I came to this organisation, I was horrified to discover we didn't have a staff training budget. So one of the first things I did was implement one. I said, I don't care where we find it from. You don't invest in people. How can you possibly expect them to firstly be happy and secondly be good at their jobs if you're not supporting them that way? And how can you expect them to stay if they don't think that you value them? So what I think we've been able to build in Ageing Australia, because we did bring together two quite distinct cultures, we have now created our own. And the feedback I get from staff is they really enjoy working at Ageing Australia. They do care about older people and they care about supporting our members. That bit we kind of take for granted, but they also enjoy working with the people they work with. They enjoy the opportunities that they get, and we make sure we give people opportunities they might not automatically get in their job, make sure they get an opportunity to go out and spend some time with a member if they're in the events team, where they might not otherwise get to do that on a day-to-day basis. Those are the kind of things that we look at to make it a really engaging workplace, to make it a place that people really only come to if they are passionate, because if you're not, it's probably not a comfortable place to be, because everybody's talking about the older person and about our members all the time. If you're just there to earn a wage, I don't think you'd last. And we've had really, really low turnover, like incredibly low turnover of staff, which tells me that people do want to be there because they care about the purpose, but hopefully also because we treat them really well and we're all a team. It's not hierarchical, it's not I'm the boss and I tell you what to do and you do it. It's a team. And I think that just kind of exudes from people when you talk to them about why they stay working for us, with us.
Speaking of team, you seem to have teamed up with Aging Asia. Is that what they're called? Aging Asia as well?
Yes.
So I didn't really know anything about aged care outside of Australia, but I'm starting to see a lot. It is happening in Asia, and that was weird to me because I thought, as an Asian, there's no aged care in Asia. We just the parents just stay with their kids. But it is, fast growing industry.
It is, and what you've just said is the stereotype, and it was a stereotype I had in my head that in Asian communities, even within Australia, but also in particularly Southeast Asia. The cultural imperative is older people stay with their family. But when I started to go to Singapore, the reason we have this partnership is because Janice Chia, who runs Aging Asia, reached out to us and said, would you participate in this conference we hold in Singapore every year? And one of my board members, Stephen Muggleton, who used to be the CEO of Bolton Clark, he's now just recently retired, but he was one of the founding directors of Aging Australia. He said, this is one to take really seriously, because Bolton Clark had been heavily involved in it for a number of years. And so I thought, all right, I'll give it a go. I went there and I was just faced with this just overwhelming kind of sense that that stereotype's just wrong. It probably was true 20 years ago. The assumption that I had made, and you had too, about cultures like Singapore, like Cambodia, Vietnam, Hong Kong, mainland China, Japan, that families just look after their older relatives. That went away with the cost of living crisis. That went away with the global financial crisis of the mid-2000s, 2007, whatever it was, because both kids have to go to work now. And so it was based on the idea that there was somebody in the family who could stay, either do very part-time work or not work outside the home, and care for mum or nan or whoever. And that has disappeared in one very short period of time. Of course, it does still happen, but it has reduced massively just because of the economic imperatives that everybody has to deal with. And so these countries have had to go from having essentially no aged care to building an aged care system within a decade. And there are countries like China that have put huge amounts of money into that. And I know in my previous job, we would talk about the Chinese progress toward having a residential care sector from nothing, to countries like Indonesia, where they're really only now starting to build even a home-based care, what we would think of as a home care system, outside Jakarta, and really having to build even the data and understanding of who's living in townships in rural parts of Indonesia, so that they know who to provide services to. So they're working. Now, we've had 150 years to build this system, essentially. There's been some form of this really in a big way since World War I, when veterans came back and we were providing care for older veterans. That has existed for a century. In countries in Southeast Asia, it just hasn't. And so it's really fascinating to spend time learning from other cultures, but also seeing what we can offer in terms of our learnings without wanting to look paternalistic or, God forbid, kind of the great white man who's going to come and fix everything for everybody. That is not at all what it should be. This is about, we've got a system that we're proud of. Can we help?
Are we at the forefront of best practice in aged care, or is the gap sort of leveling? Or, well, I guess I also want to ask, what can we learn and what have we learned from other countries?
So I think we always say we've got world-class aged care. We then do it down by saying, the Royal Commission was, the mid-term report of the Royal Commission was called neglect, and everything's terrible, and it's all hugely exaggerated. There were absolutely bad things happening in aged care, and far too often. We saw that from the evidence given to the Royal Commission. But the average was always good. It is now much better and much more consistent, and more people can access it. The reality is the way we deliver care, the clinical knowledge that we often put into aged care, so it is clinical and not just kind of a place to live. Where you still have that distinction in the UK, where some aged care is called a nursing home and some of it's not a nursing home because there are no nurses. We don't do that. So the care models we have, despite everything we tell ourselves, are really strong. We're not the best in the world. I don't think anybody could tell you who was the best in the world. Some people might point to Finland, and then you'd say, yeah, but the basic rate of tax is 10% more than ours, so they're spending so much money on it. They're also struggling to afford the care that they provide in Scandinavian countries now, as there are fewer taxpayers per older person, which we're all experiencing. We are really, really strong. I'd say we're world class. And so, of course, there's stuff that we can teach. But we mustn't forget there's also stuff we can learn. When I go to Singapore, I am blown away by how innovative they are. And by they, I mean everybody who goes to that conference. Now, Australians, New Zealanders, we're pretty innovative, but we're very risk averse. So we come up with a great invention that will revolutionise care, and then we spend 5 years getting ethics approval for the test to see whether it's actually something people want to do. And we spend another 5 years doing the business case to get the government to fund it. And then they fund it for 3 years in a pilot, and then the money runs out and we go, oh, well, that was nice, and we don't keep doing it. The country is littered with those examples. You go to Singapore and they say, here's a good idea, let's just do it. Oh, all right. And often the government will say, we'll pay for it because we can see the investment case. We don't do that well here. So we can absolutely learn that from countries like Singapore, countries like China. Hong Kong is particularly innovative, and also other countries further afield from Southeast Asia, countries from the north of Europe or South America. So lots we can learn, lots we can teach. Don't go in with arrogance thinking, well, we know everything, so we'll just fix it for you. Because frankly, I'd tell us to get lost if that's what people did to me. Go in saying, what can we learn? What can we exchange? How can we partner? Hence, we partner with Aging Asia to do that.
My favourite thing I heard about what Singaporeans were doing was financially incentivizing healthy behaviours. David Moran told me that on his episode, and I thought that's such a simple thing. Yeah. But it has a huge effect.
Absolutely it does. Now you've also got to take into account cultural difference. So, when I talk to people like Janice, who lives in Singapore, and other Singaporeans, they always remind me, remember, this is quite rule-following culture, and the history of Singapore since it gained independence, there have been pretty, let's put it this way, tough governments. We all know about the chewing gum ban and the very extreme rules around drugs and all of those kinds of things. So they'll always say to me, yeah, but it's easier for us because we're kind of comfortable within that rules environment. We saw in COVID, so were Australians for a while, but we're not now. And the average kind of Australian response to government saying we'll incentivise healthy behaviours is to say a rude word and say, no, that's nobody's business. So how do we learn from the willingness of countries like Singapore, accepting the cultural differences, to look at that kind of stuff without going, government doesn't have any right to tell me what to do, which is what we tend to do, particularly if you've got an Anglo-Saxon background like mine. We'd spend our entire lives saying government doesn't get to tell us what to do. And so we miss something in that.
Exposed me to all these different areas that I've never considered before.
Oh, well, here we are. We're learning new stuff.
That's why I love what I do. I've got a question from the sponsor here. So the question is from Aurelia Legal, which is an immigration law firm focusing on the aged care sector, specializing in navigating 482 and 186 visa sponsorships. Nilesh Bansal, the principal and founder of Aurelia Legal, asks, the aged care industry is currently facing an acute shortage of workforce, which is likely to worsen in the future. It is obvious that we cannot make up this shortage within Australia's resources. What is Ageing Australia doing to assist aged care facilities in recruiting overseas workers, including liaising with the government to reduce visa processing times, which are currently at least 4 to 6 months for the 482 visas?
So I think he's got his question backwards, with the greatest of respect to him. I don't think it necessarily has to get worse into the future, because my view is we need to focus on training our own. There's a whole range of reasons. There's having spent a bit of time talking to people in other countries, we have a terrible reputation of basically stealing skills from countries that can ill afford to lose them. But also, we need to ensure that our care sectors, not just aged care, but disability and others, are seen as a viable career option for people who are already in Australia. We need to make them more attractive. We need to ensure people are picking the courses at either TAFE or university that enable them to go into care. We don't do anywhere near enough of that at the moment, which is why we have to bring so many people in from overseas just to fill the gaps. I think something like 30% of the people who work in our sector are not born in this country. The vast majority of them are here specifically because they were recruited to come here. Now that's great, except for the issue of visas, which mean many of those people can't stay forever. So then you end up with them having their lives disrupted when their visa runs out and they can't get any more time on it. We make it very hard for people to get permanency. So even if they do come here and want to stay and uproot their families to bring them, we then make it often very difficult for them to move to permanent residency and then citizenship. So they are going to eventually go home, whether they wish to or not, which means you've got all of the continuity of care issues and making sure that you keep your culture good in your organisation when people are constantly coming in and out and not feeling safe and not feeling secure in their kind of immigration status. I know as someone who came here as a temporary visa holder, I was very lucky. My partner is Australian, and so I had a kind of a partnership route, which is a relatively easy one. But I felt so insecure for those years where it was temporary until it became permanent. If our relationship had broken down, I'd have been sent home. So I have a small understanding of how uncertain that must feel. Surely it's better to grow our own, train more people in care professions, not just nursing, which is where we spend a lot of our focus, but care workers and others who support older people, people with disabilities, children with needs. And then use international immigration for bolstering that, bringing in particular skill sets and enabling people to move to this country to continue what we've had as a very proud tradition for many, many years, which is as a melting pot country. So I think he's got his question backwards. I think it will decline rather than increase. That said, we need a lot of people to come from overseas right now to fix the gaps that we've got. And I think, we had the aged care industry labour agreements, which was something, the Achilles they're called, that was something that the government brought in a few years ago. They haven't had the take-up that I think the government wanted them to. We would say that's because they're too bureaucratic and they haven't been as well designed as they need to be, and we need to go back and revisit those. We also need to have a specialist care visa. So the generic skills-based visas or the sponsorship visas, they're very limited numbers. And you're competing with engineers and with people who fix water pipelines and plumbers and carpenters, and we need all of those people, but they're all in the same pot with nurses and with care workers and with doctors. So we need a separate care visa or care category visa in those different types, whether it's sponsored or state-sponsored regional or the points-based visas just for care.
Has that been Is that underway or has it been formally proposed?
We have proposed it, but it certainly doesn't exist now. So, the care jobs are generally higher up the list. So if you're applying for those visas, you're more likely to get them. And of course, sponsored visas are different, which is what he's talking about. But we need to make it much easier for care workers, as opposed to engineers and all of those other admittedly very important professions, to get into the country really quickly, because we have a need now. And aged care is run or regulated by the federal government, and so is immigration. So you'd think they could get together in a room and work it out. But to this stage, I haven't been able to do that.
Sounds like a lot of problems with simple issues that the government can just stamp a few papers and get it done.
To be fair, and members love it when I get critical of government, and so I don't want to give them too easy a ride. That said, I work very closely with people in government. A lot of very good people, a lot of very smart people. I used to work in the public sector, so I kind of feel, a kinship to an extent. They are working in just as complicated a system as we are. So I say, maybe flippantly, the immigration people should sit down with the aged care people and just work it out. Their legislation is different. The politics is different. The politics of immigration is incredibly challenging, just like the politics of aged care is incredibly challenging, but the two are totally different things. So as soon as you say, we'll make it really easy for people to come into the country, you're liable to get public pressure to say, you're opening the borders, and then you get into all of that nonsense. And so it would be wrong of me to say it's really easy. It is not. But it's far from impossible.
Yeah.
And they make it look like it's impossible. So I think they need to try harder. We maybe need to be easier on them and support them with solutions and public support when they do the right thing, which is what we always try to do. Government does the right thing, we congratulate them. I used to get criticised for that. If I'd put out a media release saying, we congratulate the government for this funding or that change, I'd get members writing in going, don't you dare congratulate government. I think, guys, if we don't, we're the problem, not them. But, it's not impossible if I really want to fix it.
Well, I take back my oversimplified statement. There's a lot of levels to it. Tom, now I want to learn about you outside of work, outside of aged care. What do you do to fill your own cup? Like you said, you went on a holiday. Tell me about that.
So I had become what boards called a balance sheet liability. I had so much leave saved up that it was sitting on the balance sheet, and I'm the most senior staff member, so it's a decent amount of money sitting there. Now, to be fair to the board, that's not why they said take a holiday. They're very good to me and they're very supportive, but they said, we really want you to take some leave, because they're looking out, as every employer, and a board is just a boss, just like anybody who employs staff. It's just a different structure. Instead of having one boss, I have 11, as well as, of course, the 1,100 members, but in terms of the board, 11 people. And they said, you've done enough. Take a holiday. And they were very, very kind, and they gave me a bit of extra leave to allow me to take a really decent chunk. And that's what I did. So my partner hadn't been overseas since before COVID.
Since before COVID?
Since 2019 was the last time we went on an overseas holiday.
Oh my God.
And my only overseas travel, and I say only, no, this is a first world problem. My only overseas travel had been with work. Remember, everybody listening, travel for work is not as fun as everybody who doesn't do it.
You don't see outside of a hotel and the conference that you're going to.
Or the airport lounge.
Yeah.
I am an expert in where all of the right chairs to sit are in an airport, with the right level of heat and cool and closest to the coffee machine and the view, and that's the kind of stuff you start to obsess about when you travel a lot. But we hadn't been away together, except it's in family, and we'd had long weekends, and we'd taken a week here or there to usually, because we live on 12 acres.
You've had breaks, but not a holiday.
They're not holidays. Love my family, of course, but it's not the same as going around touring the Alps.
Yep.
Which is what we did. We went to Europe, we went to Switzerland, we went to Scotland, we went and saw my family for 10 days in England. But we spent a lot of time, just the two of us, and it was incredibly, it rebuilt our energy, and I realised just from being on holiday that I was absolutely burnt out. I'd say to people now, in hindsight, I was starting to get snappy at people who'd not done anything wrong. That's when you know you're the problem, not them. And so that holiday was really important, and I need to do it again next year. We're already thinking, plan next year so that we don't forget to do it.
Well, I'm so glad you've come back re-energized for that, and now that we've got the best of you, I'm looking forward to seeing what's on for the future of aged care.
Indeed, so am I. There's plenty to do. It's never boring. I'm very easily bored. This is a great sector if you're easily bored, because it never happens.
Well, Tom, thank you so much for being on the podcast. It's been a pleasure having you on.
Thank you very much.
Thank you. Cheers, guys.